Uh, Welcome, everyone. Good afternoon. We have an incredibly important discussion we're going to have today on racial equity in the distribution of the coronavirus vaccine. We have leaders who have been advocating for equity, for accessibility, and have been doing it at the top of their lungs in order to ensure that this is done correctly. So we're going to be joined today by my great partner in the United States Senate, Elizabeth Warren, by our leader in the United States House of Representatives, Ayanna Pressley. We're also going to be joined by State Representative Nika Elugardo, who is leading up in the State House. We also have the president of the Massachusetts League of Community Health Centers, Michael Curry, who has been a longtime leader on racial equity issues, and our dear friend, Reverend Miniard Culpepper. We want to thank you for joining us today, Reverend Culpepper, because you're always there telling us what is right and what should be happening in the middle of the community. So thank you. Right from the onset of the pandemic, the Black, the Latinx, the Indigenous communities, immigrant communities have suffered a disproportionate burden of COVID-19 cases and deaths, and all of the pre-existing inequities in our healthcare system, coupled with poor air quality in our underserved communities, are exacerbating health disparities, which means communities of color continue to suffer from the worst impacts of this health crisis. They were the first to get the virus, the first to stay on the job, the first to die, but last to get the relief and the care they need during this crisis. Racial justice, and that means healthcare justice, environmental justice, and economic justice, must be our #1 priority as we combat the ongoing pandemic, and that includes vaccine distribution. As of yesterday, Massachusetts has administered more than 976,000 first doses and more than 357,000 second doses of the COVID-19 vaccine. However, even though Black and Hispanic residents have borne the brunt of this pandemic here in Massachusetts and all across the country, these communities are not receiving the vaccine in proportion to their share of the population. The latest state vaccination data shows that white residents have received 13 times more first doses than Black residents and 16 times more first doses than Latino residents. All the while, the COVID-19 case rate is more than 3 times higher for the Latino population and nearly 2 times higher for Black residents than for white residents. We cannot turn our backs on these communities that continue to shoulder the burden of this pandemic. That means first, location, location, location. We have to ensure ample and accessible resources and vaccination sites in underserved and communities of color. Second, we have to build trust between the vaccine in these communities, which have faced decades of healthcare racism, and that means getting the message out about the safety and effectiveness of the vaccine. Third, ensuring language access in our public education efforts at our vaccination sites and in the appointment process. And finally, ensuring these communities have access to the internet and devices to be able to log on and book vaccination appointments. The digital divide has become a vaccine divide, and we must bridge it immediately. So that's what we're going to be discussing here today. And we have about as great a group of leaders that have been gathered to discuss this issue as has happened in the whole country. So let me begin by just asking my great partner, Elizabeth Warren, to please, if we can, Paul, unmute to just please give us your view of as to what has to happen in this in this crisis at this time.
So thank you, Ed, and thank you for calling us together today, and it's an honor to be here with all of you. Let's start with a blunt fact. Black and brown and Native communities have been hardest hit by COVID-19. They had the most trouble getting testing initially. They've had higher rates of contracting COVID, higher death rates, and greater vulnerability. And now with the vaccines, evidence is mounting that these communities are having the most difficulty in getting vaccine distributions and equitable distributions through those communities. So that is why I've teamed up with the Congresswoman and the Senator, with my friends, Ayanna and Ed, to confront racial disparities head on in our national vaccination strategy. You know, earlier this week, just a couple of days ago, I visited Chelsea, which is one of the hardest hit communities in Massachusetts and in the entire nation. The problems of racial inequality, economic inequality that were already putting enormous stress on Chelsea were made far worse during the COVID crisis. And that's just one example right here in Massachusetts that has shown what it means to fight back, because Chelsea has shown how people can stand together for each other, work together to make sure that people within our communities have access to the vaccine from partners that they trust. You know, we have a lot of work to do, starting with ensuring that our response to the pandemic and to the economic recession is robust and that it is equitable. Congress must act to contain the virus, and that's why Ed and Ayanna and I are fighting down in Washington to strengthen and to pass the long overdue relief package and to make sure that there is money allocated for vaccines so that we can step up production, and that there is money specifically allocated to make sure that we get these vaccines distributed all across Massachusetts and all across our nation, particularly in Black and brown and vulnerable communities that have been hit hardest by this pandemic. So we've got a lot of work to do in Washington to be able to support the efforts here in Massachusetts. And I couldn't ask for better partners to do that than the Congresswoman and the Senator. So thank you. Thanks for being here. I'm looking forward to our discussion.
Thank you, Elizabeth. And now, as Elizabeth's saying, a great leader across our country on this issue of racial equity, our own Congresswoman, Ayanna Pressley. Welcome, Ayanna.
Thank you, Ed. Thank you, Senator, for bringing us together at this virtual table for this really important conversation. And, you know, certainly we knew early on from the outset of the pandemic what communities would be hardest hit, because history has proven that. And that's across the board, but when it comes to viruses, we certainly saw that with H1N1, that Black Americans had highest rates of infection, hospitalization, and fatality. So we knew anecdotally how this was going to play out, but Senator Warren and you were great partners as we started to beat that drum within weeks of the pandemic, calling for the Equitable Data Collection Act. And although that bill wholesale did not become law, key tenets of it were integrated into previous relief packages, because prior to our insisting that there be that federal mandate that racial demographic data be collected, because that which gets measured gets done. And we knew the data would then inform the coordinating, the directing, and the marshaling of resources. They were only collecting age and gender. And so that is when we first began to see these sobering statistics of the disparate impact of the coronavirus. And again, anecdotally, we knew what would happen, but to have that devastating confirmation in data did directly inform so that we could course correct in real time the marshaling of resources. Remaining consistent with that early advocacy, we started pushing for the collection of anonymized racial demographic data when it comes to vaccine recipients. I spoke with the governor earlier this week who indicated that about 20% of the data that they have is unknown. And although they can analyze zip codes, it would really support those efforts to realize equity in the distribution, to guard against what I'm characterizing as vaccine redlining, to have that other layer of information. And so that's why the three of us have partnered to push the administration for that anonymized racial demographic collection of vaccine recipients. And then on the state level, again, just picking up on what I just referenced with the governor, I also last month was calling on him to step up vaccination efforts in communities of color, because right now the administration is really failing those most impacted. The Massachusetts 7th Congressional District is a diverse, vibrant, and dynamic district, and one of the hardest hit. This is a district that's 53% people of color, 40% foreign born. Life expectancy drops by 30 years in a 3-mile radius. And that's before the new numbers came out about life expectancy and how the coronavirus has impacted that for all Americans, but disproportionately for Black Americans and other marginalized communities. We're a healthcare mecca. We have the existing infrastructure, but like our community health centers, and we'll hear from President Curry momentarily, but most of all, we have the expertise and the wisdom of those who are closest to the pain, who are wise and trusted advisors, and who must be a part of the developing of a plan and the implementation of a plan, again, to guard against vaccine redlining. So we've got to enlist every stakeholder in this, leverage our faith houses, institutions that are trusted like our community health centers, and only in close partnership with them will we be able to bring folks into this process and gain their trust. It is incumbent on the medical community to regain the trust, because it is the medical community that violated the trust of Black Americans and other marginalized communities because of the practice of medical apartheid. So it is going to take all of us. And there's no one I'd rather be rolling my sleeves up with and being in the trenches with than all of you.
Thank you. Thank you, Congresswoman, so much. And now we're going to hear from Nika Elugardo, state representative from the hard-hit community in Boston. And we'd love to hear from you, Nika.
Thank you, Senator Markey. It really is an honor to be here with you and with Senator Warren and Congresswoman Pressley, and equally an honor to be here with President Curry and Reverend Culpepper. Well, first, let me apologize to those watching for my glasses. I have some visual issues. This helps me to be with you. I'm not trying to hide my eyes, they're in there. But I do want to lay out just one more statistic that is a historic statistic that has worsened with COVID, and that is the life expectancy gap between Black people, and specifically between Black men and white men on the ends, but between people of color and white people. So at the turn of the century, Black people had we died 14 years earlier than white people. And like the life expectancy for everyone, our life expectancy has gotten not only higher, but closer. So that gap had closed before COVID all the way to 4.1 years. In the first 6 months of COVID, that gap expanded again to 6 years. So we're dying now 6 years earlier than white people. And for Black men, it's even worse, it's exacerbated, and Latin men as well. I didn't see the data on Indigenous people, but every other data I've seen is that whenever people of color are doing badly, Indigenous people are doing as badly or worse. And we talk a lot about structural and systemic racism, but we have to do more to really explain what that means, because it's not intuitive. So regular racism is kind of intuitive. Somebody hates me because of my race. That's a simple way of looking at regular racism. Structural racism isn't about hate. Primarily, it's not even about emotional states. It's not about animus of any kind. Structural racism refers to the habits of a people group, of a nation, of a state that have evolved, in our case, over centuries, that were initially designed by a particular elite group, who in this case was white male property owners, right? Because remember, folks, I saw a lot of those tweets back at you, Ed Markey, saying, why is race an issue? Remember, folks, that when the country was founded, white men were not allowed to vote in many parts of the country, if they did not own land. So when we talk about systemic and structural inequity, we're really talking about a lot of groups and a mindset that is embedded in the way that we approach solving problems in this country. Now, the corporate sector, as much as we bash the corporate sector, has actually done a lot of growth in figuring out how to do leadership development in a way that is more equitable across white people. And now they're trying to figure out, okay, how do we make that culturally relevant outside of white people? And what I mean by that is good corporate leaders in the 21st century, unlike managers in the 20th century, are not just looking at our political model. I call it the political model we use of leadership, which is take care of my buddies first, take care of any threats to me second, and then the squeaky wheels third. Nobody else gets hurt, right? You're not going to solve a systemic problem if you go to your corporate buddies first, if you're a corporate guy, and then second, you go to the electeds who you think will call you out and you make sure their particular districts are set. And then third, you go to the people that are crying because they have too many people already dying, right? So even in corporate America, they would do a social systems analysis. They would have something called an agile methodology where you're constantly testing, are we meeting our goals? You would be setting your goals and meeting your goals. And then leadership development is a big part of that. If you and when you, as many folks do in the faith community, Reverend Culpepper, in the nonprofit community, President Curry, go to the people on the ground, the infrastructure that we already have set. We have public health infrastructure in every region in Massachusetts. I mean, a solid infrastructure. They're reporting up HIV numbers. They're reporting up influenza numbers to our governor's administration, and that information is available to the state. The reason I lay out those things is because I'm so grateful for the money that we now will be able to get and the ideas from the federal side, because you all will be supported by President Biden in a way that you have not been supported by the previous administration in taking care of our folks. But structurally, it's critical that you also put both pressure and resources on our governor and on our legislature to understand what would it look like to map out, physically map out. I've done it all over the world, and I'm like a little girl on the scheme of people doing systems thinking mapping in the world. And you know, there's no excuse in places with lots of resources, with limited resources. You know, I've been in rural Haiti, I've been in rural India, I've been in London, and we've mapped out social systems to see where are the leaks and where is the capacity. This hasn't been done. And we can't just say because we're government, we don't have to be excellent. The three government leaders that I'm looking at right here, you roll in excellence and you demand excellence. And so what I'm suggesting is we need to get very granular about those demands and look not just at the result in which resources and where they're going, but we also need to look at the intellectual capital and mindset, because that's actually where the structural racism lives, in the mindsets that people are bringing to how you solve a problem. So back to that political model, when we see people going first to their buddies and second to their threats, we have to stop that in the tracks, even if we are the threat. I will be honest with you, my district is doing well. So my district is 60% white, and the 30% of folks who are Black and Latin and Indigenous in my district, they have gotten what they need in terms of vaccination if they were willing, except for the building trust piece, which I'm hoping we're going to talk about. But you can't build trust if you're not trustworthy. So back to those original things, you know, I would not be trustworthy if just because I can call people and people call me and say, hey, Nika, I got 20 slots for your folks. And my folks are set, but an elder a mile away is not set. I'm not satisfied with that, right? I'm not any more satisfied with that than if you had completely abandoned my district. Yes, I take care of my district first, like everybody takes care of their family first. And then the next 30 seconds out, you're out on the porch looking at the rest of your community. Come on in, have some food with us. That's how I grew up. I've heard Ed, Elizabeth, and Ayanna all talk about growing up in exactly the same way. Your home was open to the whole community when people needed you. That's the kind of government we have to set up. So what that means in terms of tangible reality is bringing in some of the social entrepreneur practices that are even at play in nonprofits across Massachusetts, that are at play in this infrastructure of public health that we've got, and in community health centers all around the cities across, and towns too, across Massachusetts. So we're capturing also our white rural people. Our white rural elders are not being served. We now have a Black state rep representing part of the Cape. And he represents very predominantly white people. But because I get to meet with him regularly in the Black and Latino caucus, I know that they also don't have access to vaccines. And he has the most aging, I think, population in Massachusetts. So we have to map out these systems. And that means going to the leaders who already have the trust in the community, the faith leaders, the public health leaders, the community health leaders, and not just asking them belatedly, but in July, we got a vaccine coming through in December. July, this group should have been around with, our counterparts. What should we do? And then those decisions could be implemented by people who know how to implement them. Put the resources there. So if we could have some type of resources to study how we would go about shifting our mindset and building an infrastructure, so that in the future, we won't be having this conversation. We'll be having another conversation about, okay, now we're reaching everybody. What can we continue to do to build that trust? But without going to the trusted players, no people in our communities are going to trust government or the healthcare system.
Beautiful. Thank you, Nika. That was very powerful. And now we're going to hear from Michael Curry, who is the president of the Massachusetts League of Community Health Centers, these great healthcare facilities all across the Commonwealth. Welcome, Michael.
Thank you, Senator. Senator, it is a blessing, an honor to be on the call with all of you today. You'll be interested in my day that I'm having. I woke up this morning and joined the National NAACP board call at 9 o'clock. I took this break for this call, and I'll be signing back on at 1 o'clock to 5 o'clock to participate in the 112th year anniversary of the National NAACP. I just want you to know that in a few minutes, we will hear from Mayor, soon to be Secretary of Labor, Marty Walsh, as he brings greetings to the National NAACP Board of Directors. I would start by saying that we know that all of you, and I get to work with you in all the hats, both the NAACP hat and the Massachusetts League of Community Health Center hat. Senator Markey, you often reference the A that you get from the National NAACP for the way you vote. I'm on this call now with folks who get A's, Congressman Pressley, Senator Warren. You are what I call leaders who have a compass around civil rights and social justice work. And that matters in this moment. Whether we meet the moment really depends on the kind of work that you all do and the stuff that you're championing, like collecting data. And Nika, I will tell you, Representative, you taught a masterclass on this call. So one of the things I will take away is what you just shared with the people, that they were fortunate to hear you share that. I will just in brief say, as many people have heard the quote, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. We're at this moment that none of this should have been a shock. None of it should have been a shock. I call it our national Katrina, that we should have known when that storm hit the area that those that would be most likely to die, most likely to suffer, most likely to lose their homes would be the ones who are poor, who didn't have transportation to leave town, who didn't have the money and resources to stock up or go live with loved ones in other states and other areas, that they lived in congested households, that they were most likely to die because they had comorbidities and couldn't shift and move on a dime. The same issues play out here with COVID-19. We should have known. I often use the phrase, and I do it intentionally, we defunded our pandemic response. As we have this conversation around defunding, we defunded our pandemic response. And we should have known that Black and brown people would be most likely to die. Congresswoman Pressley, my dear friend, started us off, and she has a quote that I love. She said, "Those closest to the pain should be closest to the power." And I made a spin on Congresswoman's quote, and I said, "Those closest to the disease should be closest to the vaccine." That's the moment that we're in. Too few of us are getting the vaccine in Black and brown communities. And unfortunately, that's not just in Roxbury, Mattapan, Dorchester, That's across the country. And we should have known that that would play out because our systems were never set up to equitably provide care for Black and brown people. I often remind people as I do this presentation, Ayanna, called Quantum Leap, where I take people back to 1619 and walk them all the way up to 2021, and I teach them about the institution of slavery. I walk them through J. Marion Sims and his experimentation on Black slaves, Anarcha, Lucy, Betsy, women who he experimented on without anesthesia. I walked them through the early part of the 20th century and the fact that we didn't have access to healthcare. And then in 1918, the Spanish flu hit. And who were the closest to the disease in 1918? Those former slaves, just a few decades out of slavery, Black folks living under Jim Crow, poor, congested households, no resources. None of this is a surprise. One of you said earlier in a phrase, past is prologue. None of this should be a surprise. So I think now as we talk about community health centers and the role that we play, we know that just 55 years ago, Jack Geiger, Count Gibson, God bless his soul, Jack Geiger, who just died in January, as all of you know, got together with Senator Kennedy and organized what we now know as the Community Health Center movement. Those closest to the pain should be closest to the power. They sit on the boards of health centers, where over 50% of our boards have to be consumer members if you're on the board of Whittier Street Hospital, Whittier Street Health Center with Frederico, or Manny Lopes in East Boston, or Greater Lawrence Family Health Center, or Lynn and Senator Warren. I think about you often as you just visited Manny Lopes and his team in East Boston and Chelsea. I think about Ayanna representing the largest number of community health centers in the country. And then I think about Senator Markey and the work that you do to connect with us on a regular basis about policy. What do we need? Your staff call me all the time. What do you need? How can I get your resources? So we're very fortunate in Massachusetts to understand that this was born, health centers were born out of civil rights. This is their moment. This is our time because we speak their languages. We know their cultures. We're in their communities. And as Jack Geiger planned it, it was never just about medical care. It was about water resources, about transportation. It was about those social determinants of health that drive people into our facilities sick and have us, like Nika said, dying of diseases 10 to 15 years before white Americans. That's the work of community health centers. And I'm proud to join you today and be part of this conversation.
Thank you, Michael. And thank you for your great leadership every day and for decades on these issues. What a leader. Now we're going to hear from Reverend Miniard Culpepper, speaking for the faith community. And I know that Reverend Culpepper, I saw your picture getting the vaccine as a community leader to set the example. So welcome, Miniard.
Thank you, Senator Markey, and it's always a pleasure to see you and work with you and stand with you. Thank you, Senator Warren. As always, you know, we're still prayer partners, and my good friend, Congresswoman Ayanna Pressley. You know, this pandemic was something that early on, the churches saw what was taking place. We always see it from the ground level. We're always the first to encounter it with our members and just trying to figure it out. And so one of the first churches that really experienced deaths were in Washington, D.C. And we huddled, we put together the COVID-19 Clergy Committee of Boston, about 25 pastors, to try and figure out. We brought data from all over the country. We looked at churches. We looked at how some pastors, some bishops were passing. And we came up with a plan about how to transition out of our churches so that we could all go on social media. And it was so effective. It was just amazing. Not only did we transition out of our churches to go on social media and to do virtual services, we also looked at what were we being told. And I think one of the things that really caught us early was when Dr. Fauci and everyone was saying we didn't need to wear masks. And everyone was focused so on sanitize, wash your hands, 20 seconds. And they were saying we didn't need to wear masks. On the other hand, we were looking at China. Everyone in China was wearing a mask. but they were telling us we didn't need to wear masks. And I think one of the things that happened as the pastors started talking and looking at what was happening outside of the United States, we started looking at trying to make sure we got PPE for the pastors that were in the churches and for the few members that were working with us. And then we pushed the PPE out. It just so happened Gordon Thompson from WestNet he was really on top of it. And Gordon said, what do you need? So he sent us 12,000 masks. He sent us 25 gallons of sanitizer. He sent us 25 cartons of the sanitized wipes. And so we were distributing that from Pleasant Hill to the different pastors that were coming by, picking it up. And once we saw that, we also were concerned about testing because people were concerned about testing. So we came up with a plan about testing. We were having our conference calls every week. And so we said, our folks aren't getting tested. So we decided to go down to Whittier Street. 15 of us went down. We got tested. We had a press conference. We did a little video. Then once people saw that, people really started, I think, taking note of maybe the testing is something they need because folks were so mistrustful. Like Michael said, this is not something that folks just started not trusting the government. They, when you look at Alabama and the syphilis experience, I mean, I caught that as a young man at the end of it in the early 70s. And so the whole notion of can we trust the government always loomed large. And so we said we would take it on. We did the testing. The other thing we did was we moved the testing to the churches. And so we worked with Whittier Street. They brought their van to the churches. We would test on some nights 250. The line would go all the way around the corner. And we were testing even into we had flashlights, we put lamps on, because we knew that our folks were going to come to the churches because of the relationship with them. And if anyone is going to speak truth to power, speak truth to our people, it's their pastor. And so it worked. I think we started arranging churches all over the city. We had a schedule. We published it, and folks were going all over different churches with the vans. They were doing the testing outside. We're doing the same thing with vaccine. We went down this week. 6 of us got the vaccine for the first time. 6 of us yesterday got our second shot. And the thing about it, it's important, these pastors didn't even know they were in phase 1. And there really has to be an education piece so that we can really educate folks about what phase they're in, because they just know. The pastors didn't even know that they were in phase 1 until we started telling them. So we started scheduling them to go down. We were doing it 6 at a time. And I say in the beginning, I did not want to take that vaccine shot. I was skeptical. I said, I'm not taking that shot. We had focus groups with the doctors and nurses at Whittier, and we were doing focus groups 6 at a time, just like we did with this group. We would have a Zoom with the doctors and nurses. We asked them all the questions we had. We brought in questions from our congregation, answered them. After that first focus group, 5 out of the 6 pastors decided they would get the vaccine. And so one of the things that I think we really need to drill down on is helping folks understand exactly what the vaccine is, exactly what the vaccine does, who's eligible at what point. And then you've got the literacy part, you've got the whole online part, you've got the whole, that really becomes a challenge if folks don't have a computer, folks can't go online. We've seen some folks online for 6 hours trying to get on. Well, I don't know too many folks in my church that can take 6 hours out of the day to try and get an appointment. So we really need to come up with a strategy, an intentional strategy. And I heard Ayanna mention spirit impact. The spirit impact is not intentional, but the impact that it's having across the board is we need to come up with a strategy so we can narrow down and we can really focus on the folks that we really want to get the vaccine. And so we're talking now about, just like we did with the testing at the churches, setting up certain churches to do the vaccine shots, because I think most of my members of my church either have committed to do it, a lot of them. Sunday morning, we'll have pastors that will talk about the vaccine because they either had the first shot or the second shot. We really need to put together a plan. So I'm all in, senators and congresswomen and Mike and Nika, on trying to put together a plan that really works and that will really touch those folks on the ground that many times are ignored or just left out. Thank you.
Thank you, Reverend Culpepper. Thank you for your leadership. So let's talk about education. If we could, maybe you, Michael, could talk about what the community health centers are doing. Actually, Senator Warren and Congresswoman Pressley and I, we're working to add billions of dollars to this next coronavirus package to make sure that the funding is there, the education funding is there, but maybe we could have a little conversation about what you would like to see happen to make sure that that the community has the information they need. Michael, maybe you could talk from a community health center perspective.
Yeah, so quickly, Senator, I think all three of you who represent us down in DC are pretty modest about what you do. I think anyone who identifies the footprint and the importance of community health centers needs to know, if you're not on this call, as Ayanna, we say we need you to tell somebody about our three members of Congress. We would not have health centers but for the three of you. We faced some really challenging years over the last few decades. With economic downturns, with a pandemic that hit, which would have driven many of our health centers out of business. And it was the folks like the three of you that fought for community health center funding. We already know that health centers operate on thin margins. They have low days cash on hand. I remember Senator Warren, before the Affordable Care Act and before ARA, the American Recovery and Reinvestment Act, Governor Patrick, a friend of mine, walked into one of our health centers and he said, the buildings we treated these patients in often reflected what we thought of the patients. Just to let that sit for a moment. Mm-hmm. That they're located in Black and brown communities and immigrant communities with all this anti-immigrant rhetoric that we had over the last 4+ years, not just the last 4. And the reality is health centers serve that population. So Senator, what's critical is the stuff that you're already doing. You helped us reauthorize the community health center program. And now, in order to meet the moment, health centers have to build up their infrastructure. We know that, and you all are part of this, recently the CDC and HRSA identified 15 health centers here in Massachusetts, 250 plus across the country that'll be on the front lines receiving direct shipments of vaccines. And they're the health centers that all of you have visited. They're the health centers that you know well, that know you well. We hope that more will come to other health centers so that can supplement, as Secretary Human Services, Mary Lou Sutters here, it's not to replace, it's to supplement what they're getting from the state, because people identify health centers as the tip of the spear. If anybody can walk into Brockton and convince Cape Verdean and Haitian patients, community residents to consider taking the vaccine, that's Brockton Neighborhood Health Center, just a few miles down the road from me right now. If anyone can convince people in Mattapan, that's Guale and Mattapan Community Health Center, which Reverend Culpepper amazed me this week. They launched with BMC, Boston Medical Center, and my bishop, Reverend Bishop Borders. They opened up a vaccination site right in the church. I was there. And I can tell you, having advocated for health centers, and I want people to go into health centers and whatever access point, there's something inspirational about walking in a church and seeing people be vaccinated with a smile on their face, with confidence, as the bishop was there, as his congregation was there to support them, as I got a shot. Because people said, we want you to know, if you out here telling us to get a shot, we need you to get a shot. So I want to say to people that there is a movement now afoot, and the investments that you all have done, and Representative, you on the state level, the resources matter, but we got to build up the infrastructure. Because if health center is going to meet the moment, they got to be able to repurpose that community center next door, or move into that church. They got to be able to have the PPE or the workforce, the National Guard, all those things that give you the infrastructure, Senator Warren, to then meet the moment. And I know you know that, Senator Markey and Congresswoman Pressley knows that. And I've been beating that drum. So just again, I see on behalf of our 52 members, the million patients, the communities we serve, I am very fortunate to be president and CEO of the Master League. I have colleagues in the South and the Western part of the country that don't have a delegation like we do, don't have champions like Nika in the State House. So I got an easy job compared to my colleagues because you take my call and you call me when something is up and we need a resource health center. So again, thank you.
Thank you. So Elizabeth, Ayanna, would you like to talk about this issue of ensuring that education funding is increased so that the community knows the importance of getting vaccines?
Ayanna, you go ahead. Add your voice here. I'll come in behind you if there's anything I want to add, but I want to hear your voice in this more.
Okay, Senator, that's a quality of voice here at this virtual table. So
I love this.
I will do my best to not be the granddaughter of a Baptist preacher and err towards brevity in this response. But I'd be remiss if I did not just say, Michael, how fortunate we are to have you. I have maintained for a long time that representation without righteousness means nothing. So it's not just enough to have a diverse representation around the table if they're not bringing righteousness. And by that, I mean being deeply rooted in community. And so, I thank you for your leadership, for your perspective and for your vigilance. And, look, we're all partners, and a key component of any partnership is accountability. And so we hold each other accountable, and we insist that those that we represent hold us accountable. And to Representative Elugardo's point around, it's not just about, resourcing and what comes down federally. It is about that strict accountability that we hold our partners to, in this state. And that does include the governor, which is why, and again, to his credit, when I was critical about the crisis care standards, and so many of us were, he changed course in real time because we organized and applied that pressure. Same thing about asthma not being prioritized in phase 1. We organized and we pushed for that. So when it comes to education, I think what we have to acknowledge is 2 things. One, there's a lot of misinformation online. And we need trusted voices and healthcare professionals to debunk that misinformation. Misinformation about the efficacy of the vaccine, people not knowing the percentage of people of color that were a part of the trials. And again, to the point of accountability and the power of righteous representation, I did a panel like this with a representative from the NIH, a Black doctor and researcher who specializes in cardiology and things like that. And he said the reason why we were in those trials is because they insisted we be in these trials. And so there's no mandate that happen. And these things are not naturally occurring. So the injustices are not naturally occurring. They're precise, they're legal, they're legislated. It's either a blind eye and ignorance. But the point is, it wasn't naturally occurring. And so the prescription, pun intended, we have to be just as intentional as the harms have been. And so we have to debunk this misinformation. The vaccine was not developed too quickly. It's been being developed for a long time. People of color were a part of the trials, and Black doctors were key in the development of this vaccine. And then the last thing that I want to say, which really shocked me but shouldn't have, because I'm on the phone with constituents every day, with healthcare providers, with advocates and those who serve our most vulnerable, incarcerated men and women, congregant communities that people don't consider to be a part of our community, who have been very vulnerable and also hit hard. But I was talking with some of our providers and advocates for those experiencing homelessness that are unhoused. And they were in the first group. But guess what? They were afraid, those who work with the unhoused and those experiencing homelessness, and those who are unhoused and experiencing homelessness. You know what they said? We have never been first for anything. And what a sad commentary on, like the hierarchy of society, that their skepticism was, we've never been first for anything. And instead of them rushing to then get vaccinated, that made them cynical because they have never felt prioritized by the community of which they are members. So just on an education standpoint, I wanted to offer that. And, again, say that it is about not only physical infrastructure, not only about what my dear sister in service, Councilor Mejia, refers to as information justice, making sure that we're communicating in a way that is accessible and digestible and in multiple languages. But again, it is about those trusted voices. So just to echo what everyone has said here, those are the people that need to be empowered. Ed, Nika, Elizabeth, Michael, look at the collective care and mutual aid that has emerged in the midst of this tsunami of hurt.
Yes.
The human infrastructure, the care economy, when we thought it was improbable, that is where the resiliency of community has come with this. Look at what our faith leaders have done. Many things that we thought could never happen. So those are my thoughts on education. We have to debunk the misinformation, and that's as much about the trusted representatives in the healthcare community as it is about folks in community.
Cool. Senator Warren.
I think that's fabulous. And I completely agree with what Ayanna's saying. And I just think about what we need to be doing at the federal level based on the kind of conversation we're having here. I look at this and think, we're doing this, I hope, in this bill. This is what I think the three of us are pushing very hard for. At the first level, we want to get more money into vaccines. We want lots more vaccines going out. We want everybody to be able to get those vaccines. So more money into vaccines and more money into distribution generally. But the next level down is we are articulating in this bill, it has to go to community health centers, because community health centers are where we get it done. But there's a level down from that in terms of kind of the granularities you talk about it, Nika, and that is the on the ground how we deliver this. So what we have pending right now, and I'm very hopeful it's going to be in the final version of the bill, is there are specific resources that go into the question of education, of distribution in the hardest hit communities, in communities of color, so that money is there to respond to exactly what you're talking about. Miniard, it's there to try to help set up those partnerships, or not set them up. That's even the wrong verb for me to use. It's that as you develop them, as you have the ideas and say, here's what's going to work here. This is what's going to work at Pleasant Hill. This is what's going to work right here in our community. How it is that there's then enough resources to come in so that, as is happening at over in right now in Chelsea, that the community health center could partner up with you and get those doses out, get people there who can administer them, because we need both. We need exactly the resources coming from the federal government, and at the same moment to have it meet the community. I don't mean this badly, not to just have it meet the governor, not to just have it meet the communities that always get a lot of help, as Nika rightly points out, but to have it meet directly the communities that most need this, closest to the pain, as Ayanna says, and to say, tell us what works for you, for your community, what you can do fast, what you can make work to get more people in the door, and we're going to support that in every way we can.
That's right.
That's what we're struggling to get in this bill right now. I think we've got a lot of good partners, and our job over the next 2 weeks is to make sure what we're trying to do here doesn't end up on the cutting room floor, that it doesn't get a lot of, but we're just actually going to put money into vaccines, and not this deeper question about how we make sure that there is true equity in getting these vaccinations available to everybody.
That's right. That's right. Because it is not naturally occurring. It requires intentionality. And thank you. I'm not doing my job in lifting up the bill. So thank you for doing that, Senator.
No, you're doing great.
Also, the key thing that I appreciate you're underscoring there is the nimbleness of the funds, because we know very often money comes down from the federal level and it's so rigid in its application that people cannot be innovative and malleable on the ground. So that is a key component, so that you can do things like record public service announcements, which many of the Black and Latino elected officials just did, or to have multiple sites or things in different languages, or to your point, whatever, to curate it according to the specific needs of your community.
Right. Banners, right? That may be what you need. You may need $100 for a banner. So the money needs to come. It needs to be nimble. Love that word for it, Ayanna. I'm going to keep using that. And it needs to be fast. We don't need this 6 months from now. We need it right now. So that's going to be the push behind it. So I couldn't ask for better partners than I've got on this. And knowing it's good partnership, not just with Ed and Ayanna, which is terrific. It's good partnership with folks like the Reverend, with folks like the representative, good partnership in knowing that if we get that money into Massachusetts, that money's going to be well spent. That's going to be creatively spent. People are going to have good ideas and they're going to make it happen. Because that's what it means to care. And that's what it means to make the right things happen intentionally.
Beautiful. Thank you, Senator Warren. Thank you, Ayanna. Thank you, Nika. Michael Curry, to Reverend Culpepper. We got started a little bit late, but this was a fantastic discussion, which we had. I was up at the Lawrence Community Health Center yesterday. They've been really hard hit. 70% of the people in Lawrence speak Spanish as their first language. They're doing 7,000 vaccinations a week up there in that region, which is amazing. But they're going to have to bring in the National Guard and their medical personnel to up their ability to be able to reach everyone who needs it in the community. So what we're working on right now, Senator Warren and Congresswoman Pressley, we're working on adding $25 billion to this reconciliation package, which Senator Warren just made reference to get it passed. And that money will just be focused on vaccine equity. And that's a dramatic increase over the funding that we had last year on the issue, because we can see the problem. And as you said, Michael Curry, those closest to the COVID-19 should be closest to the vaccine. So that's going to be our goal, to dramatically up the resources to make sure that that funding is there. And as we go back this week to the United States Senate and House of Representatives and put together the final touches on the reconciliation package, this $1.9 trillion bill, we're going to make sure that racial justice, vaccine justice is at the heart of it. So, so we thank you, and we could not have three more trusted community leaders than you, Nika, and Michael and Miniard, for what you do. Thank you all today for joining with us on this live stream, and to my partners, Ayanna and Elizabeth. We'll be back to work this week, trying to implement what we have learned. We'll go from concept to implementation of what we know has to happen. So thank you all so much. Thanks for joining us today.
Thank you.
Thank you, Ed.
Thank you.
Pleasure to be here.
Thank you, Senator Markey. Thank you, Senator Warren.
Bring us
Congress-
together.
Thank you.